Welcome to our video series on tracheostomy. Today we will be covering an introduction on the tracheostomy, a demonstration on trach tubes and their parts, and trach care, how to keep the trach area clean. The tracheostomy is an opening that was surgically created through the neck into the trach to allow air to fill the lungs. It provides an air passage to help you breathe when the usual route for breathing is somehow blocked or reduced. Now we will do a demonstration on the different parts of the trach tube. The parts of the trach tube. This portion here is the neck plate or the flange. We have the inner cannula, which is either cleaned or replaced. We have an outer cannula, which stays in the patient's neck. We have a pilot line and a balloon. This indicates the trach is cuffed on the inside, which would look like this on the inside of your patient. If it's uncuffed, this is what the trach will look like on the inside. And the last part that we have is an obturator. This is what allows the ease of the trach to be inserted. Tracheostomy care is important to help provide a patent airway to prevent blockage and/or plugs. It also helps to prevent infection as well as helps breathing. Before starting, we will do an assessment on our patient, heart rate, respiratory rate, breath sounds. We'll wash our hands, collect our supplies, and then begin by unpacking our trach care cleaning set. So we'll unpack our cleaning set. We have our normal saline. We have our sterile gloves. We have our sterile drape, which I will unpack by only touching the bottom portion of the drape. And then I will drop my supplies on the drape. I'll fill my 3 compartments with my saline. And then I'm going to begin by putting on my gloves, sterile technique. So we want to make sure to start by grabbing the gloves on the inside of the cuff and only holding the inside. I like to keep it cuffed so it makes it easier for me to slide the gloves down onto my hand. And then I'm going to grab my second glove on the inside of the palm. Once I get my hand in, again, I use my cuff to slide my gloves into place. And now I'm sterile, and we can go ahead and get started on cleaning. Okay, first we're going to set up our supplies, and I'm going to separate everything. I have my pre-cut drain sponge, my gauze, which I'm going to separate. I have my Q-tip, which I will put in my bin here. I have my pipette cleaners and my brush. And then we're going to go ahead and start by taking the inner cannula out. And I'm going to use my gauze so that I can try and stay as sterile as possible. Making sure not to cover up the actual trach tube hole so that the patient can still breathe. I'm going to go ahead and put that into my big bin, which I will go ahead and use for cleaning. I'm going to hold it in the bin, and I'm going to clean it using my brush and clean the outside. Making sure not to be this high, because if I'm this high, then everything is now non-sterile. So I'm going to stay in my bin to clean. To clean the inside of my inner cannula, I'm going to use my pipette cleaners. I'm going to put one in on the top, and then I'm going to drop it in there. That's the dirty section. And then if I needed to use another pipette cleaner, I'm going to go ahead and use the other one on the other end. And once it's clean, I will rinse it in this bin here. I'm going to tap it dry. And then I'm going to go ahead and reinsert it into my patient, making sure that I turn the inner cannula to lock it in place. The next step is going to be to take the drain sponge out, and I want to try and be as clean as possible, so I'm going to use my gauze to do that. I'm going to pull my drain sponge out and put this in my trash. And then I'm going to go ahead and clean under the trach close to the stoma using my Q-tip. I'm going to lift up my neck plate and I'm going to slide my Q-tip closest to the stoma. I want to make one swipe, either left to right or right to left, no up and down and no side and back. Okay, and then I'm going to go ahead and do that on the bottom, and I'm going to lift up the plate on the bottom and get around the stoma there. And then I'm going to put that one in my trash. I'm going to allow that area to dry quickly. And then the next thing I'm going to do depends on the day of the week. If today is the day that we're changing out your trach tie, I'm going to change my trach tie first before I put in my drain sponge. If we try to put in our drain sponge before we change our necktie, the Velcro will get caught on the drain sponge and it'll make it a hot mess for you to try and put it on. But today's not the day to change my tie. He's got a brand new tie from yesterday. So all I'm going to do is put a new drain sponge in. Now, if I don't have a pre-cut drain sponge, we do not cut our gauze. If we cut our gauze, the twill can end up in the airway. So if we don't have pre-cut, then we could always use regular gauze, and you can fold it in two and slide it under the flange until you can get pre-cut. But today we have pre-cut. So I'm going to use my pre-cut and I'm going to slide it under my flange. And we want to make sure that it is totally under my flange and that the cut is going up, because this helps to protect the stoma should the patient have any secretions. It'll catch the secretions so it's not just pulling on the patient's skin. So we always make sure that the drain sponge is always facing up on the cut. Once completed, I will take my gloves off, gather my trash and put it all in a biohazard trash bag. And then I would assess my patient again, the heart rate, respiratory rate, and breath sounds. And I would document my findings. And then next we'll talk about common problems with trach care. Common problems of the tracheostomy tube is that they can be blocked by blood clots, mucus, or pressure of the airway walls. Blockages can be prevented by suctioning, humidifying the air, and selecting the appropriate tracheostomy tube. Trach care is important because it helps prevent any blockages in your patient's inner cannula and continues to provide a patent airway. Thank you for watching our series on trach care. If you have any questions or concerns, please don't hesitate to call or email our customer success team. We want to equip you with the tools you need to provide the best possible care to your residents. That's why we've developed our online toolkit. You can find this toolkit at mosvithehealth.com/toolkit.